Hi, this is Mariah with Lofty Hopes. We are a pigeon rescue based out of Las Vegas. We rescue pigeons, doves, and lots of other animals. Today we're going to do a class on what to do if you find a poisoned bird. So we've got, let me show you what we've got here. Let's see. This is Toxaban, and it's activated charcoal, and it's used just like CPR, or not CPR, but for people. You know, if somebody overdoses, they give them charcoal, and it absorbs the poison that's in their stomach. So this is the same kind of idea. You're giving Toxaban, it's a charcoal, and it will soak up the poisons. This stuff is concentrated, so you only need a little bit. I get mine on Amazon. Okay, so this is Toxaban. I keep it in my car with a 1cc syringe. In an emergency situation, you could just add it right to your water. Add it right to your water bottle, and if you needed to, you could absolutely draw 1cc at a time out of the cap. I have had to do that, and I've done it, and it works. So basically what you're going to do is you're going to pour, I like to keep a little mason jar, and I pour maybe just the bottom full, right? Just the bottom full of Toxaban, and I keep it in my car. And I always have water in my car. If you don't have water in your car, you can totally add the water right away. I fill it up to about there. So then once you've got your Toxaban mixed, I just mix it up. Right? And you've got your pigeon, and the pigeon is suffering from symptoms of poison, and you can tell the symptoms of poison because the eyes, the pupils of the eyes, they call it pinning. So the eyes get bigger and smaller, the pupils do. Sometimes they'll do opposites, or one will stay small, one will get bigger. So that's one of the signs. You will see them having seizures. You will see a lot of tightening of the muscles, a lot of shaking of the head, full-on seizures. You'll see, everyone I'm pretty sure knows what a full-on seizure looks like. But if you don't know if it's poison, it's not gonna hurt to give Toxaban anyway. There's food grade charcoal that people add to their smoothies, and so it's not gonna hurt, but it will hurt if you don't give the Toxaban if it is poison. So when in doubt, give it anyway. So basically, once you've got your stuff mixed, and it's important to get this done as fast as possible. You draw it up, okay? A small bird, you can give about 30 cc's. A large bird, you can give about 40. I do about 3 or 4 cc's at a time to kind of gauge where they're at. If it seems like the seizures are slowing down or stopping, I'll just sit with them for a minute, talk to them, and give them about 4 or 5 more. And then when the seizures stop, I stop giving the Toxaban. So I usually do 4 or 5 at a time, up to 40 cc's total. Okay, so it is important anytime that you are giving a bird anything down their throat to know that on the back of their tongue there's a hole. That hole is how they breathe. If water gets in that hole, it will go down into their lungs and they will aspirate and die. So you want to always take your syringe and make sure that you're going past the hole in their throat down into their crop. Their crop is their stomach. It sits about right here. When it's empty, it's kind of flat, and when it's full, it will look big, and it will actually kind of feel like breast tissue. When it's empty, you can't really feel much in there. You kind of feel bones in there. So if they have a full crop, you don't want to give too much Toxaban because they can throw up. And if they throw up, that fluid can get in that hole on the back of their tongue and they can aspirate and die. So you just want to be really careful. You know, it's better to do something than nothing. Now, pigeons are very tough. You can handle them pretty toughly. It's important to get this medicine down quick. The faster the better. So even if you have to be a little rough, things like broken bones can be fixed. Death cannot be fixed. So even if you have to be a little rough, if there's an emergency situation, it's the same thing as doing CPR. You know, you can break bones. It happens. You just want to get the Toxaban in. You can be a lot rougher with a pigeon than you probably think that you can. So the next thing we're going to do is I'm going to grab Raja over here and show you how to actually give the Toxaban. Okay, so here we've got Raja. Here's Raja. Hi, Raja. So the easiest way that I have found to give medication or Toxaban, or anytime you have to use a syringe or anything to get down a pigeon's throat, easiest thing to do on me. Okay, wings in. Let's get our wings in, right? You put their wings in, you hold their wings down, and that helps them too when they're having seizures. You can take off your shirt. Here we have our Flossy Hope shirt. You can wrap them like a burrito. Wrap them up like a burrito in your shirt, okay? Let's get this tag out of the way. Of course that tag's gonna be in the way, huh? Okay, so to open their mouth, you're gonna pinch the sides of their beak. Then you can stick your finger in there. So what I do is I kind of put my fingers in the way, right? In the way, so that it stays open. I put my pinky on the back of their head, and you open up that airway. Not here, but here, open, right? And then I take my syringe, and you'll notice that it's kind of wet. So I don't like putting that in their mouth wet. So I always just kind of wipe it on my pants or wherever, because it's an emergency, right? And you're going to shove it down their throat, right? You put it down their throat. You're okay. If you put it down their throat, turn them sideways one way or the other, and aim towards yourself, you'll actually be able to see the syringe sticking out of the side of their throat. And then you just push the plunger. You can give up to 30 of those for a small bird like Raja, and you can give up to 40 for a large bird. And just stop every 4 or 5 and see what you think, how it's working. That's it. How to help a poisoned pigeon.